Welcome to the Brave Change Pod, where we're going to share stories and insights from global health and development. In this episode, we meet Rejoice, Mabayo, and Shaddad, three Acasus colleagues from Nigeria and Chad who chose to return home after time overseas. They share what drew them back, how they're putting their global experience to work, and what it means to build a world-class consulting career in the places that matter most to them. This is a conversation about purpose, belonging, and the power of coming home to make change happen.
What do you value the most about your time away, and what do you like about coming back home?
I think I'll start with the second question. I missed the food the most and the weather. I never thought I'd miss the sun. Yeah, but moving to England was a very difficult one, and I grew up around my family and my community, so having to leave them back at home and come into a new place with very different weather, very terrible food, no shade to the British. But yeah, that was difficult. What I valued the most for me was the opportunity to mix with people from different backgrounds. I attended a very diverse course, if I would say. So I had people from at least 60 countries.
That's a lot.
So engagements every day were just ever new, and I could learn something about someone's culture, background. It was just really good.
How about you?
Yeah, I think almost the same thing. So you're reconnecting with family when you come back home, and it's very joyful time to see them back, but also knowing that you're bringing some skills that will help people in your home country, which is really impacting, and it brings you this sense of responsibility, and I'm very proud of doing that. But what I'm missing is, of course, thing a little bit slow compared to when I was abroad. So the project is going in some speed that I'm not quite familiar with, and also missing some friends, some places that I like to visit.
No, I definitely get that, because I feel like I'm always straddling two continents. So being in the UK, which feels like home, had its own missing, especially the weather. The months between October and February are so long and so dark. It's so cold. So it's been nice to not have to go through another British winter this year. But I think also being here has given me the opportunity to explore my other home. Nigeria has always been a second home for me, and it's given me an opportunity to explore areas of Nigeria that I'd never been to before. I spend a lot of time in the northwest of Nigeria, and it's my first time, and it's the first time for many of the people I know also going to northwest Nigeria. So definitely a massive learning opportunity, and I see what you mean about it being an honor to give something back to the community, because I think we definitely need to help our communities.
Yeah, and I think one thing that I want to highlight here is you need to be patient. People, different culture is a big shift, so you need to be patient and to be able to understand, to adapt, and to talk to everyone in order to be accepted, because you're coming from another earth, and some people sometimes feel a little bit scared to approach you. So
Yeah, that's good.
I definitely agree with that. I think one of the biggest risks is thinking, oh, because this works in this way, in this place, that it should work. And actually, not only that, but that the other way of doing things is wrong.
Right.
And I think there is an acceptance that you have to come to that actually it's not wrong, it's just different. Will there be things wrong? Yeah, for sure. But there are things wrong everywhere. And I think it's embracing the difference and really thinking about, okay, how do I then work with the difference for us to get to where we want to get to?
It's like the problems are similar in different contexts, but then the difference in culture then makes your solutioning be different. So,
Right.
I mean, there's a lot of problems that we share with like the people from Nicaragua, Cambodia, which is people I spoke to in school. But then the way that we would approach it as Nigerians would be totally different, because we're a very homogenous group. And even the Northwest, Amobaya was talking about having to visit, is very different from the Southwest where she grew. So things that would naturally work there would then have to be regionally contextualized. And yeah, I saw the beauty of that, having to engage with my classmates.
I think returning back home was back in my mind for a long time ago, and it's become stronger over the time. One thing that turned me on this one is I got a small project. I worked for a small project for the Ministry of Health. A little bit opened my mind and opened my eye on how I can contribute to make the system better, because I saw that I have some skills that people inside the country don't have it. And that's bring me to the thing that, I need definitely to return back to my home country. One thing is I come from military background, and one thing that's very important for us is to serve where we need the most. And the place is Chad, so.
Man of service, man. I don't know. I didn't have any like aha moments. I think it was always part of the plan. I was brought up by this big community, and in the work that I have chosen to do in my life, it's improve health outcomes, and I have grown up around people who have died from like vaccine preventable diseases or just poor health outcomes in general. And the plan was always to go learn things and then come back and help improve the system. I think Nigeria has a lot of potential.
Right.
I would say the reason that I had the opportunity to go study and then come back is because of the community that I have around me. And the plan is to always give back and make sure that opportunities are created for other people. And the opportunities manifest in different ways is the work that we do to make sure that children receive vaccines and they have a chance to live beyond 5 years and then get the education that they need. It's the mentorship that I probably provide to my cousins or my sisters and show them how capable they are of influencing policy and change in their communities or even within government. So the big decision for me, I would say never happened. It's just the running theme in my life where I have to give back to my community and I see myself as an example. So
That's a good point. How about you?
I remember I was it was my first meeting with my mentor for my master's program. And he said to me, "So, where are you going to live?" And I thought, that's an absurd question. I'm sat here right now with you. I live somewhere. You asking me about my college accommodation? But and he kind of probed it because he's also a bi-continental individual, America and the UK, and he was kind of probing, and with the ambitions that I have, especially with government and giving back, he said, you're going to have to make a decision. And that was the first time. There had been moments in my life where I felt like something was prompting me to think about a decision, but that was the first time someone had actually asked me. And when they asked me to make a decision, I realized I didn't have enough information to actually make a decision either way. But it was also emotional because I felt if I was to pick one continent or one country or the other, then I would be giving up on the other country. That's a signal that nobody actually asks. Like there'll be no national newspaper story that she gives up on one country and picks the other. So I did feel like there was a part of I wanted to come and actually have, for lack of a better word, the data to back a decision that I was going to make. Ultimately, when I think about children and I think about the citizens of the future, I think about the Nigerian child. I think of the Nigerian child that's been so underserved. I think of the Nigerian child that has leaders. We have the capabilities, we have the capacity, and we just are not serving our citizens properly. So when it then came to that end point of the master's program, I thought, let's go serve the Nigerian child. It should be a newspaper headline. Serving the Nigerian children. It should be. We have this movement, it's called the Japa movement, where we have thousands of people across every sector leaving Nigeria because of the economic situation, and things have been getting considerably harder. So saying to people that you're moving to Nigeria, I had an aunt who said, "Oh, you couldn't get a good job in the UK?" I was like, "Oh, no. We're serving the Nigerian child. This is what we're doing." But yeah, I think it's a difficult decision. And I think a lot of people don't really see the value of coming home in that same way. But I definitely think that it's been a valuable decision.
I think just building on the Japa conversation, I moved to England at almost zero cost to my parents because I moved there on the scholarship. And then people have to save extra, like to pay tuition and then get all the immigration documents. It just didn't make sense to have to come back because if I change my mind, then I'll have to do it on my own dime. But yeah, definitely people don't think I'm okay. And another thing is, I felt some people might interpret it as me giving up my youth because the way that the system works in Nigeria, the youth suffer the most because you don't have parents to depend on, and you also don't necessarily have the capacity to act like a big adult because you're not in a functioning society that has helped you build your savings, give you a good job. So it was a lot of people don't understand because there's multiple reasons why I'm not, but I don't think a lot of people share my own story because, like I said, we're here for a reason and we definitely do have to give back. So.
Yeah, for me, the story is a little bit different because I spent almost a decade working around Europe and United States. So returning back is for me like a normal transition to the people that need the most help. And everyone in my family understood that it's a very important thing that maybe everyone can contribute. So that's quite smooth transition and a good thing for my people.
First daughter, firstborn Nigerian daughter. I think I've always had we look up to you. We do look up to you. It probably stayed the same for the most part. But then now I feel like I have expectations of my siblings. And I think I'm a lot more clear in the way I communicate it because I've seen maybe like a world of possibilities or something. So I've moved from the role of inspiring to now also expecting certain things from them.
For me, I think I came back with experience, with skills that make a huge difference. So when I left the country 10 years back, I was a student at the college, so I'm not able to provide anything to the citizen, to the people of the country. But right now I'm bringing some experiences, some skills that help people. And I saw this difference. For example, last time we went to the east of the country to one of refugees camp near to the border with Sudan. And we did the supervision, and after the supervision, so we provide like small coaching to these health workers, and they came back after we finished all this coaching saying that, yeah, thank you so much. That's something that we didn't see before, and will make a huge difference in this area. So something like that, I'm not sure I will be able to provide it before coming with all these skills and knowledge.
I think it's a really interesting thing that both of you touched on with perspective and how you have a perspective that you can share with other people. And I think it's important not to be condescending or patronizing with that perspective, but then actually helping other people broaden, whether it's their personal expectations, what they expect from leaders, what they expect in terms of their outcomes, but helping other people see that there are a world of possibilities that perhaps they wouldn't see, you know, if you exist within that small microcosm of your community. So I think it's really interesting coming into a community, being able to provide a different perspective. So even in the work that we do, actually having seen how other countries run their healthcare systems, having seen when I moved to Nigeria, I'm working on a polio project. I had to ask my mum. I said, I don't know what polio is. And I don't know when the UK eradicated polio. But it's not even one of those things that they teach in biology class. Like, it's just not a thing. But coming back, and it's not necessarily just about polio, but it's a whole perspective on a system of you deserve better. These are things that globally we have been able to get rid of. So there is no reason why our children should be suffering things that we've gotten like we've all moved past this. So why are we making people content with this being their reality? How do we both help people understand there is an alternative reality, but also actually play our part in making that alternative reality come
Yeah.
And if you think about the Nigerian society, the problem has never necessarily been the capacity. So on the points whereas we're not coming in being condescending, because what, you left Nigeria, spent a few years abroad, and you think you have all the answers. Like, no. I have been doing this work for decades. I understand the system. I know what works best. But for me, it's just the possibility mentality that I came back with, that I try as much as possible to translate to the stakeholders, even to the associates, to my manager sometimes when he feels a bit frustrated, is people have done it and they're not necessarily smarter. We have the capacity, we just need to position ourselves well. So that constant reminder is something I have to carry all the time. And also being very mindful and respectful of the people who have also tried to solve these problems, not making it seem like everything they're doing is wrong, but it's the consistency that we have to do it with that is probably lacking, or just the strong institutions that we will definitely take some time to build, that we need to invest in for sure.
Totally agree. We need to be humble and help them in the way that they want it. So that's something totally I share with you.
Even though I am British, there are interesting conversations happening in the UK and around the West generally around immigration and immigrants and who is British, who's not. Existing as a Black woman in England over time becomes increasingly exhausting because you're dealing with the women side of things and you're dealing with being Black, and then put those two things together and it's the whole many hours of your day being very exhausted. And actually coming back, it's been nice, and perhaps this might sound flippant, but it's been nice to not be Black. I'm Nigerian. And even though we are still dealing with deep-rooted patriarchy in Nigeria, I feel like a small bit of weight has been shifted, and then focusing on actually women and how women are, for us, even in our work, women are primary source of care.
Yeah.
If we're talking about children under the age of 5, we're talking about women. If we're thinking about things like HPV, we're thinking about maternal care. We're talking about women. And it's been really important for me being back to think about, okay, how are we progressing these conversations about women? Again, similar to eradication of all these common vaccine eradicatable diseases. People have moved on past some of the patriarchal problems that we have. We haven't solved the patriarchy anywhere, and that's a separate conversation. But people have moved on. We've moved past some of the conversations that we're still having in Nigeria. We've moved past the level of gender-based violence that we're seeing. And I think I'm quite fortunate to be from a background that prevents me from experiencing these things directly on a day-to-day, but that's also not good enough. Because you look out into the community and you can see, actually, we really need to change these things, and we need to change them quite quickly. So yeah, I think it's been an eye-opener or a reminder, I guess, because it's a different kind of beast that we're dealing with in Nigeria, but still doesn't seem like a problem that can't be solved.
I definitely agree with you. I don't think I have much to add on to that one, but I would just speak about being a woman in Nigeria working in public health and have to work in policy, and then also working on the ground where you're trying to make change in health facilities that are being run by men, and you're working with technicians that just a group of men, and you have to go to security compromised places, and you have to just work in environments where women are not as accepted. I remember a few times, I think just before I left Nigeria, I had to wear a wedding ring just to work on the field.
Yeah.
Because, I mean, you're respected a whole lot more if you're married. And I had this interaction with a stakeholder one time, and he was like, "Oh, your ring is really nice." And then I was like, "Oh, thank you, but I'm not married." And I don't know why I told him that. And he was like, "Oh, so you're a small girl." And he moved from Madame to Rejoice. quickly. So ever since that interaction, I've sort of had to carry myself a certain way and not think about my age, or not think that I don't have enough experience when stepping into certain places, and just assume that act ignorant about like my gender, and just think that I can do whatever it is that needs to be done. So 2 weeks ago, we were working in some very remote parts in Kano, and we had to travel to places that couldn't even be accessible with the cars, and all the entire team of technicians was like, "Are you going to go? Like, are you sure you can go? Are you sure you can go?" And the answer was just yes. And we went there. We were able to fix the SDDs. I think at the end of the month, we fixed around like 16.
It was impressive.
Yeah, and the problem with it is if there is no supervisor going with them, you can't then guarantee how many freezers are fixed. And I was the only one available. So if I had sat in the, they wouldn't necessarily respect me, this isn't somewhere I could go, then who knows how many we would have fixed. So I find myself just operating blindly to my gender sometimes, which maybe might not be the answer, because you need to acknowledge and then work with the differences that both women and men bring to the table. But I think that's how I've had to navigate it so far.
Sometimes you're fighting for space.
Yeah.
You know, you're fighting for your voice to be heard. You're fighting for your ideas to be heard. But I think also we do have this opportunity to role model this behavior for other people with the experiences that we've had. I have a new young associate who I love very much. And, you know, being in that space, she came with me. She works in another state, but she came with me. And being in that space with her and just showing her, this is how I navigate this heavily male-dominated space. When she's also elsewhere, she can also just think about, okay, maybe I can adopt some of these techniques and that will help me in the work that I'm doing as well. So yeah, I think we fight for the space not just for ourselves to get, and not just to get the work that we personally need to get done, but also for the other people that might need to get work done.
My manager themed August of focus. September is supposed to be September of impact. And we had just very specific goals that we were running with. I was responsible for making sure that we fixed 80% of the repairs for freezers where vaccines are stored. And there was something about going with the technicians and watching a freezer come to life. It was so good. Like, it would be dusty when we would get there. Maybe not being in use for like a whole year or even like 2 years plus. And then the engineers go in there, they take all the dust out, they bring out the panels and they start to fix things, and you can see the red lights coming on. And if you wait a bit, you can feel it get cold. And I think what also made it so impactful to me is I had to make the journey from like the community to the health center, and I came in a car. So imagine people who have to work, who work in the health facility, and then imagine the caregivers who have to come receive it. So it's a distance that they're working, and then sometimes a facility can't provide the services because they don't have the vaccines at that time. But then just creating the opportunity for there to be more spots where people can access the vaccinations, it felt really rewarding. And I think at the end I mentioned that we fixed 16 freezers, so that was good. Yeah.
Almost in the same thing, we've been able also to reduce the stock out in 50 provinces in Chad.
Oh, that's huge.
Yeah, that's huge, because we've been able to break down the delays during the distribution, and we've been able to see exactly where we need to focus our attention, especially in the financial aspect and all the delay related to administrative procedures, stuff like that. So we focus on those. We try to bring all the stakeholders to explain to them that, yeah, that's a huge problem, we need to fix it. And we've been able to reduce the stock out in these provinces by 50%, which is amazing. Yeah, that's amazing. And that will have a huge impact also on the coverage of the vaccination and also the number of children that will get prevented from some diseases.
That's really impressive.
Yeah.
So our work in polio is a bit more strategic, but I think we introduced this new framework, which is a new way of how we look at where the worst performing polio and most at-risk polio areas are, and how we work in these campaign cycles, how we can use campaigns to ensure the most amount of children can get vaccinated. So we took this new framework to each of the states, and the feedback from the states, they were just saying to us, for the first time, you can tell us where our problem areas are. We've had all this data, people throw these numbers at us, but we don't really understand who is meaningfully contributing to our problems. Where are we missing the children? Right. And actually it was such a rewarding conversation, because sometimes you especially with sites, I completely agree. I think fixing a freezer and stocking vaccines beats slides, but sometimes you're sitting in a room, and we were working really late trying to crack this framework. And sometimes you're sitting in a room and you just think, okay, well, we're going to put it out there. Let's see what happens. But to get that feedback from the states and the states to say, oh, now we can think about this differently. Now we can do this differently. And that's ultimately what we're trying to get to. We don't want you to be doing the same thing that we've been doing for the last 2.5 decades to fight polio. We want you to do something different so we can have different results. So yeah, I would say that was probably the most rewarding moment.
Help. In one word.
Did you say help?
Yes.
Are you asking for help? Are you screaming for
Helping
help?
people.
Oh, helping people. No, I thought you meant help.
Yeah.
Like help me.
Not helping me.
I can't use one word. I could say
Citizens.
no, because I have this running theme of my community. It's always my people. I'm doing it for my people. It's always for my people. Yeah, it's for the people. My people.
Yeah.
my people.
Mine.
Yeah.
Yeah. I think it feels 9 months in. It feels like there's a purpose here.
Yeah.
So I think purpose.
That was Rejoice, Mabayo, and Shaddad on coming home to deliver brave change. Their stories remind us that global experience has the greatest value when it's brought home to strengthen systems, to serve citizens, and to show what's possible when talent and purpose align. If you enjoyed this episode, subscribe for more stories of brave change from people who are helping governments deliver better health and education for millions, one bold act at a time.